Great. Well, good morning and welcome. We're so happy to have you here this morning, spending your time with us. We're excited to be with you to share our updates for the California Healthy Places Index. Our webinar is timed to celebrate National Public Health Week, and this year's theme is Public Health is Where You Are, recognizing that where people live has a profound impact on their health. We'd like to kick off this morning with a quick poll to get a sense of how familiar you are with the Healthy Places Index. Please use the poll feature to answer for us if you're very familiar, somewhat familiar, or not familiar with the Healthy Places Index. All right, we'll give it another moment here before we close our poll. All right, Courtney, let's see what our answers are here. All right, so the majority, most folks are either somewhat familiar or not familiar. We have a 19% that are very familiar. So that's great, because we're going to have information here that will really help you out and get going. You don't need to know about the HPI that much to hopefully get something out of this conversation. So hopefully there's something for everybody here. I'm Tracy Delaney. I'm the founding executive director for the Public Health Alliance of Southern California. And the Alliance is a coalition of the executive leadership of 10 local health departments representing 60% of the state's population. We're fiscally administered by the Public Health Institute, and we're also the architects of the Healthy Places Index and the reason why you're here with us today. I'm pleased to be joined by my dear colleague, Helen Dowling, who is the Alliance's data manager and guru on all things HPI. I'm also thrilled to introduce a couple of partners in this work who you will hear from later today. First is Kimberly Sarawatari, the Director of Public Health at the Riverside University Health System, otherwise known as Riverside County Public Health Department. Kim began her career in public health over 20 years ago and has worked in a number of areas, from immunizations and outbreak response to HIV/AIDS and community epidemiology. She has led the Public Health Department's response to the COVID pandemic and the development of enhanced partnerships with community and faith-based organizations, the education sector, and businesses throughout Riverside. Then we'll also hear from Minister Deborah Williams. She is the founder and CEO of Building Resilient Communities. Deborah created Building Resilient Communities and its various programs based on her strong faith and 25 plus years of experience as a management consultant to large and small community, public, and private organizations. Deborah has led the organization's COVID response with a focus on the unique needs of the African American community, which she will tell us about more later. We're so grateful that they're able to join us today, and we hope you learn as much from their work as we have. We welcome both Kim and Deborah, and we'll be hearing from them soon. We're also posting more detailed bios in the chat. So over the years, our intent has been to make the HPI a powerful, easy to use data and policy platform. Our goal is to provide essential information to help identify community conditions to address equity, prioritize equitable investments, and strengthen community voices with sound, validated data. Today, we'll be sharing what the HPI is, why it exists, reviewing its existing community impact and how it's used. Then we'll share a few case studies from our partners, Kim and Deborah, who can speak to how the HPI has already made impacts, as well as demonstrated best practices. We're excited to then unveil what's coming next for HPI and to showcase its impressive new features and how you can best implement these into your work. And lastly, we've included time today to answer your questions. As far as a few housekeeping notes, we will have everyone on mute to help decrease background noise. Throughout the presentation, we encourage you to provide comments and ideas into the chat box. If you do have questions for us that you'd like us to answer, though, we ask that you please use the Q&A function, which you can find in the lower menu bar of your screen. Just click on the Q&A icon and enter your question. That way we can keep track of the questions in one place and make it easier to address them. We'll have a couple more poll questions throughout the talk, and you can just answer those on your screen like you did at the beginning. And finally, we will share the recording of the meeting and a few additional resources after the webinar. So why the Healthy Places Index? Decades of research tells us that our life expectancy and well-being are tied to community conditions in which we live, which includes the existence of racially driven laws and policies. We know that access to social conditions that support health, what we call the social drivers of health, education, good job opportunities, healthy food and water, for instance, vary drastically by neighborhood for a complexity of reasons. More specifically, we also know that systemic racism is a major barrier to health. Communities of color continue to disproportionately experience negative economic, environmental, and health outcomes due to racist policies embedded within our systems. Our team at the Public Health Alliance operates with the understanding that in order to create lasting systems change, both race and place must be recognized and understood to drive change for an equitable future. So it's for these reasons we created the Healthy Places Index tool, which launched in 2018. The HPI, was expressly built to highlight community assets and strengths using a positive frame that can be used to mobilize and implement solutions. The HPI maps neighborhood level data on conditions that drive health, layered with racial justice data and resources, and provides community-specific policy recommendations. The main goal of the Healthy Places Index is to advance health equity. The HPI provides data and policy recommendations to compare health and well-being of communities, identify community conditions at neighborhood level by quantifying factors that shape health, and support communities and leaders to turn data into actionable solutions to advance equity. The HPI scores and compares neighborhoods across the state based on how healthy local social conditions are. The tool, specifically the new HPI 3.0, does this by evaluating the relationship between 23 key social drivers of health tied to life expectancy at birth. The HPI provides a score representing the relative rank of community conditions in a selected area, which can be filtered by a range of geographies, including census tract, zip code, city, unincorporated areas, congressional districts, and more, and compares it to all the other such areas in the state. Our data and policy recommendations are organized by 8 key policy action areas: economic, social, education, transportation, neighborhood, housing, clean environment, and healthcare access. So who can use the HPI? Well, anyone. We've made this platform free, accessible, and easy to use to ensure that there's fair and open data available to all. Anyone can use this tool, and we believe the following sectors could really benefit from what HPI has to offer, including state and local leaders, government agencies, school districts, the media, community-based organizations, and more. I wanted to quickly take a step back to recount where we've been. Since 2018, the HPI has become a go-to data tool for hundreds of state and local agencies, foundations, advocacy groups, hospitals, and many others. The tool has been adopted by hundreds of organizations for various uses, addressing critical community needs, like active transportation, affordable, stable housing, food security, climate resilience, and of course, the health equity metric that influenced COVID funding and support. We're proud to say that the HPI has been used to inform the distribution of over $1 billion to community-focused investments, including $272 million during the COVID response to communities that were most impacted by the pandemic. At this point, I'm excited to turn it over to our partners at Riverside University Public Health and Building Resilient Communities to tell us more about how they use the HPI in their work. Kim, I'll turn it over to you.
Great. Thank you so much, Tracy. And Tracy, Helen, thank you for having Deborah and I here today. We're really excited to share how we've been using the Healthy Places Index. And just to kind of set the stage and give you a little bit of background, Riverside County is the 10th largest county in the country. We're 7,200 square miles. It takes about 4 hours to get from one end of our county to the other. So we have a very diverse population, very diverse geography throughout our county. We also have a lot of challenges when it comes to health, and that is probably best demonstrated by the fact that we have a score of 30.4 out of 100 overall as a county on the Healthy Places Index. So we're, definitely in the bottom third in terms of health throughout the state of California. So the reason why Healthy Places Index has been so critically important for me as a public health director and for our department is it makes it so much easier for me to talk to elected officials and my county executive officer about health and about how, as Tracy mentioned, race and place impacts health, and how those 8 policy action areas, all of those things impact health. And I know I'm probably preaching to the choir here today with all of you on the call. But a lot of times elected officials, unless you can show it to them, it's harder for them to grasp what we're talking about, whereas we live this every single day. So the Healthy Places Index, I was really fortunate to be able to spend a lot of time with our now county executive officer before he became our CEO, and talked a lot about the Healthy Places Index, and was able to show him on a map, look, this is our county. These are the areas where we know people are healthy, and look at all of these things that have contributed to their health. And conversely, these are areas where we know we have a lot of work to do. And these are areas where all of these things have contributed negatively to health. So it's been really, I have to say, a godsend in terms of a tool in order to talk about health in a really comprehensive way with anyone who will listen. Prior to HPI, it was really hard for us to have the ability to paint a clear picture to the elected officials. And we needed to have something that was comprehensive in one place that could tell the story. And HPI just does that beautifully. Next slide, please. So our county executive officer, I mentioned I spent a lot of time with him, particularly during the COVID response. He is a true believer in Healthy Places Index now. And in fact, he talks about Healthy Places Index and its usefulness as a tool every time he gives a presentation. And it's really exciting for me because now the focus of our county is really on health. And as I like to say to all of the department heads across the county, everything that they do impacts health. Every single thing in some way or another, whether it's transportation and building walkable communities, whether it's probation and how they're impacting students in schools, or recidivism into their system. I could go on, but everything that's done at a county level really does impact health. So our county CEO, when he was promoted about a year ago, he actually restructured our county department into what we call portfolios. And so we have a health portfolio that includes public health, behavioral health. We have a county hospital and 13 federally qualified health centers. We also have a public safety department and a transportation, land management, and then of course our administration. And so our county CEO has really set a goal for us to raise our HPI score by 40 points in 40 years. Now that's a lofty goal. But it's something that it gives us a goal. It gives us a focus as a county on what we want to accomplish. And for me, it's really super exciting. I'm really excited to see how HPI now is starting to be used. So we've used it for many years in public health and have partnered with the Alliance on many different projects. But now we have our probation department. We've been working with them in partnership to look at their clients, where they are across the county, how where they live is influencing their outcomes. And the probation department, our chief probation officer, also very supportive and a diehard HPI fan, which is super exciting because public safety is usually the hardest to get into and to partner with on health related things, not because they're not interested, but because they have a different focus. And so now having the chief probation officer on board with that and his whole department is really exciting. And I think there's a ton of opportunity in how we can partner going forward. And so we're having ongoing conversations about that. Our emergency management department, they're using Healthy Places Index when they're looking at things like their call distribution for our contract ambulance providers, and then also looking at the records, the electronic records from ambulance runs and outcomes and what chief complaints are, and overlaying that with the Healthy Places Index to really be able to tell a story about communities that are most in need. We're starting to have conversations with our sheriff's department about how we may be able to look at the services they're providing with relationship to Healthy Places Index and the different types of communities that they're in and why certain interventions may or may not be effective. So that's just a couple of examples of how we're using it in our county, but again, really super excited about the prospects and the future with support from our county executive officer and all of the department heads. You know, the nice thing is that we can say to any county department, let me show you this Healthy Places Index, and I can really show you the work that your department is doing and how it is impacting our score as a county or a neighborhood score, and how we can partner together to raise those scores and have a bigger impact ultimately on health and life expectancy. I also just want to mention that this fits in perfectly as well with our Board of Supervisors. We have one particular Board of Supervisors member who is a huge supporter of public health. And he and I, throughout the COVID response, have been talking about the fact that we want to really be able to dive into communities and bring the resources in partnership with community-based organizations, faith-based organizations, because we know we can't do this work alone, but partnering with all of those partners to really do a focused, put a focused effort on work in community at the community level. And the Healthy Places Index is the perfect tool to guide that work. And so our Board of Supervisors member is a big champion for that as well. So again, big prospects. And I think the future is really exciting for Healthy Places Index. Next slide, please. Just a couple more examples I want to share with all of you about how we're using the Healthy Places Index in Riverside County. So we are using HPI data and turning that into action. So a few years back, we won an overdose data to action grant from the CDC. And so we call our program the Riverside Overdose Data to Action, or the RODA initiative. And so we use data from HPI and created a platform that has information about overdoses from the coroner's office. We have data from the emergency departments. We have data from EMS about overdose runs. We're starting to add information from community-based providers about naloxone distribution. And so we can add all of this in using HPI as the backdrop and look where we need to have very targeted interventions at the community level. So I can't say enough how powerful the HPI is in terms of a tool for us. Next slide, please. So we also have, through our RODA initiative, created an interagency overdose fatality review team. So we bring together folks from the district attorney's office, the hospital, emergency management, which is also our EMS agency, from the sheriff's department, from public health and others. And we review all of the overdoses that occur in the county and look where we could have intervened earlier. And again, using HPI as a backdrop, we can really see at the community level where we have issues that we need to dive into and really get interventions into those communities so that we can have an impact upstream and hopefully prevent overdoses. So this work that we've been doing through RODA also kind of led into a board of supervisors. Our chair of the board at the time created a fentanyl task force because we have a definite issue with fentanyl in our county. And we've seen a huge increase in fentanyl deaths in our county over the last 3 years. So again, HPI feeding the RODA work and really creating a very clear picture that then is used by our fentanyl task force and communicated to our elected officials, to county departments, to the community, to all of our partners. And so now we have timely overdose information available to the community. So not only us in government, but all of our partners can also use that and again, identify what types of community interventions and where those community interventions might be the most effective. Next slide, please. And lastly, I just want to talk a little bit about our COVID response. I know everybody has a bit of COVID fatigue, but as you can imagine, HPI has been integral to all of our COVID-19 response efforts. So using the Healthy Places Index, we created a vaccine equity task force. And so we use HPI to look at how we're doing in terms of distribution of vaccines. Are we getting vaccine out to our communities in an equitable fashion, looking both across racial ethnic groups and geographic distribution? And then using HPI to prioritize our vaccine allocation to those communities that are disproportionately impacted by COVID. So, in our communities, it's been migrant farm workers, it's been our Black African American communities. And so HPI helps us to tell the story so that we can then work with medical providers, community-based organizations, faith-based organizations, all of those stakeholders to say, this is why we need to get vaccine into these communities. We can see that they're at higher risk because their health score is lower. And we know that they're at higher risk for COVID. And so HPI, again, a very powerful tool for our vaccine equity task force and distribution of vaccines. I can't underscore enough, though, the importance of collaboration and partnership as we've gone through this journey, whether it's been with county departments, but specifically for the COVID response with our community and faith-based organizations. They really have been key to the successful distribution of vaccines and earlier on testing, contact tracing even. They've just been there with us every single step of the way. And we've been fortunate that our board has been supportive and allowed us to provide funding to CBOs so that they can be there with us hand in hand as we're fighting the pandemic and trying to protect our communities. So CBOs, I'm really excited to say, have been using Healthy Places Index more than ever before. It's a tool, it's a powerful tool. All of us, it's kind of a tsunami, I guess, of everybody kind of getting on board with the use of HPI and everybody realizing the powerfulness of this tool. And so I'm going to stop at this point and I'm going to turn it over to one of our very favorite community-based organizations in Riverside County and to Pastor Deborah Williams, who has been a phenomenal partner for us. So Deborah, I will turn it over to you.
Thank you, Kim. I want to publicly say that not only are we honored to work with Riverside County Public Health, but working with all of you as well as other counties, we see the difference. And the fact that you wholeheartedly embrace the need for an equity task force and then reached out to us and other CBOs to say, join us, is wonderful. And it is a tremendous collaboration that it started because of COVID, but it won't end after COVID. And so, well, good morning, everyone who's here. I'm so happy to be here and to share just a little bit of information about building resilient communities and the work that we're doing and how we utilize HPI. This is really the first time that we have used it in this very distinct way. Building Resilient Communities is a nonprofit. We've been in existence since 2012. We are a faith-based nonprofit, and we work across the entire Inland Empire of Riverside and San Bernardino counties. Primarily, we work on disaster preparedness, response, and recovery. And so we consider COVID as a response, a disaster response effort. So that's a little bit about who we are. And I know you can go to our website and you can look at lots of the information about all of our programs. So next, let's talk a little bit more about what we've been doing for COVID response and how we're using the HPI. You see on the screen all the different things that we've been doing. Our community engagement team has been out there just hot and heavy from the very beginning, doing everything from getting PPE out to people, free mask and hand sanitizer, to setting up different clinics, working with public health to set up different clinics, especially in the various churches and areas where African Americans really go on a daily basis. So this is what we have been doing, but it's not just us. This all takes a village. You've heard that saying, it takes a village. And we do believe in the whole community approach when it comes to disaster preparedness, response, and recovery. And so when we started hearing about other agencies that were out there that wanted to help in the African American community, we reached out to them and said, come on, let's all join together. Let's all start working together because we can be one team with one mission. And so the next slide shows some of the agencies that are a part of what we call the African American Collaborative. And I will tell you that there are so many agencies and organizations out there that want to help, even though they're not getting funding. That part does not matter to them. All of these agencies that you see here are not being funded through public health. They may have other funding, or they may be saying to us, we don't care about the funding. We just have to help. People are dying, and we are tired of seeing people die. And so this is a lot of the agencies that we're working with. You see that it's not just CBOs. We have some of the universities that are in the local area that are working with us. And one that I really want to point out is the Moreno Valley Unified School District. They are an incredible partner in this whole effort and just getting the word out, holding clinics, and doing their superintendent doing everything that they can to get people tested, vaccinated, and informed on COVID and treatments and everything related to COVID. We call ourselves the Underground Railroad, and I'm sure you're familiar with that term. So we've all just come together as the African American Collaborative. And next. So how do we use HPI? Well, being the people that we are, we said, if we're going to be successful, we need to know where we are right now, which was March 4th of 2021. And we want to look at what does success mean. And so you can see there that in the African American Black community, it was only 9.3% vaccinated back in March of 2021. And at that point, we all kind of threw up our hands and said, oh God, we have our work cut out for us. But now look at the next slide. HPI. Every week, public health attends our meeting on Thursday morning, and the first thing we start with in our meeting is, where are we? How are we doing? For a couple of reasons. One reason, we say it's in the data. It's all in the data. We don't know what we want to do, where we need to focus, unless we look at the data. And so the data tells us where to start. It also tells us what the progress is. So you see here, March 2nd of this year, 58.7%. And we know that it's higher even now. But that's, that makes us excited. I've often laughed and said, I'm going to make a sign that says, we'll work for shots, because we need to see the data so that we know where we are, that we are making progress. If you've been doing any COVID response work, we're at that point where it's kind of like the dog days of summer. The people who wanted to get vaccinated have gotten vaccinated. And the people who don't want to get vaccinated, there's some that are never going to get vaccinated. So we're now working with that small group of how do we get them to shift? And so that's the harder part. But we're at 58.7%. And we would not know that without HPI information. And most importantly, on some days, this is our self-care. This is what gives us hope. Showing us the data tells us we are making a difference, even if it's one person and one shot at a time. Next. The HPI also tells us, where do we go? Where do we need to go and do the work? Who do we need to, drill down to those zip codes and really focus on those particular areas? Now, what you're seeing here is the zip codes, but another view that we get every week is African American men versus African American women. And that's one that made us realize more women are getting vaccinated. We need to do education campaigns for the men. Would not have known that except for HPI. Next. So how do we use all of that data and turn it into action? Because that's where the rubber meets the road. It's one thing to see the numbers, but it's another thing to say, okay, now what are we going to do? So because we work with trusted messengers, and every community has trusted messengers, in the African American community, one set of trusted messengers are the pastors in the churches. Another set are the barbers and the beauticians in the beauty salons. People listen to them, and they're there all the time. They're right there with them. And so we started, UC Riverside took the lead on an effort that's called Stop COVID in the Black Community, Conversations with the Congregation. We developed a toolkit for the pastors because we talked to them and said, how can we help you? And they said, we're struggling. We're trying to get the message out for people to get vaccinated, but we're struggling. Give us some help. And so we created a whole pastor's toolkit with talking points, videos, resources, everything that they need to speak to the people who listen to them. And then I mentioned the men's toolkit, the men's campaign. We now are working on the men and having them do their own listening and talking sessions. Men who have been vaccinated, men who are refusing to get vaccinated, and let them discuss it. I'm not even going to be there. We're not there. We're letting it's peer to peer. And so that's how we are taking all the HPI information and turning it into action. And it's working. You can see that it is working. Next. But let me tell you, this is only the beginning. It may be COVID that caused the African American Collaborative to get started, but it won't be the end. All those things that Kim mentioned that they are working on, now we are saying, let's go, let's run. What are those underlying conditions that have been in BIPOC communities for generations that we have not addressed? Tell us what you need. Let's strategize together. Let's figure out how we can work on the public's health in every way possible. And HPI is the one that is making that happen. Thank you so much.
Wow. Well, Deborah and Kim, thank you so much. You're getting all kinds of comments, and you just, the passion of the work you're doing just is coming through. It's amazing. And this is why we created HPI, is to hand it over and see the creativity and how people at communities can take it and really mobilize the change. And we really see the work that both of you have done as just these amazing best practices. So thank you for sharing with us. I have chills actually hearing all of this. It's just amazing. So I'd like to just remind folks, if you have questions, please go ahead and put them in the Q&A section. I see a few that are coming through specifically about HPI, and we'll answer those towards the end, because we have a little bit more of an HPI presentation. So maybe we'll answer them, and if not, we'll go ahead and answer them at the end. But if you have questions specifically for Debbie and for Kim, Deborah and Kim, please put them in the Q&A now, and we'll go ahead and address those while we have these wonderful speakers with us, and we're so grateful for your participation. So while you're thinking of your questions in the Q&A section, we have a poll that we'd like to ask you, just to understand a little bit more of who's in the room here. If you can tell us what type of organization you're a part of, that would be very helpful for us. You know that a lot of different sectors are using HPI. You know, we saw one in terms of education, academia in the chat. So go ahead and enter your responses, and Courtney, maybe you can close it. We can see the answers. All right, so we've got a lot of local government and state government folks here, but not that. We also have really important other sectors, including CBOs and healthcare system, some businesses, and other academia and others. So thank you all for joining us. We think that there's many different ways that HPI can be used across different sectors. So let's go ahead and see a few of the questions here, if I can ask. Just a lot of praise and congratulations on the amazing work that you're doing. One question that came from Dustin is, how does one connect their local CBOs and government organizations to try and develop this kind of an initiative that you all are working on? If you've got any recommendations through these couple of years hard work that you've done.
Kim, do you want to go first?
Sure. Thanks, Deborah. Just really quickly, I think that public health has a long history of working at some level with CBOs, probably on a more limited scope. What we did is we reached out to the CBOs that we do work with and said, who else is out there that's doing this work that we know? And, as you heard Deborah mention, her organization was primarily focused on disaster emergency management. But someone that we talked to in emergency management said, you need to get Deborah and her team. So we kind of put out feelers through emergency management because they were a critical partner in the COVID response with us. And then the CBOs that we already had relationships with. And we quickly got a list of probably about 30 or 40 CBOs and did the same thing through our faith-based work. And so from there, just reached out and said, hey, are you willing to come on board and help us? And early on, and Deborah can tell you this too, there wasn't a promise of funding, but it's moving really Deborah said, yeah, I don't care about the money. I care about the people. We're just going to jump in. So I think it's just putting the feelers out there and seeing what kind of response you get. But Deborah, please jump in.
Yeah, I would say, I mentioned trusted messengers. Reach out to the trusted messengers. Find out who they are. Who do the people listen to? In the African-American community and in the Latinx community, it's going to be the faith communities. The group we haven't mentioned is the Catholic Diocese, and they've been involved in this and have a huge effort in it. And they all of the churches, they don't just work on spiritual things. They are community minded. They are our whole community. And so for the government, I would say, know that you can't do it all by yourself and be welcoming to the CBOs, because even with disaster response, we have always said, when the fire's over, the fire department leaves. When the shooting or the bad guys are caught, in law enforcement leaves. But it's the community and faith-based organizations that are left to pick up the pieces. And so start looking around. Who are the trusted messengers? They're already doing the work. They may not know about you, and you may not know about them. Just start getting connected. VOAD, if you are familiar with VOAD, Voluntary Organizations Active in Disaster, reach out to your county or state VOAD. A lot of the CBOs are there also.
And Deborah, I think that your passionate presentation, somebody's even asking if you have any job openings because they want to be involved in your work.
We do.
So can you tell folks where they would log on to if they want to check out your opportunities for jobs?
Jacqueline, our wonderful administrative person is here. Jacqueline, can you put our website in the chat, as well as Queen Hamilton, who is our HR person? Put her email in the chat.
Will do.
Yes. And we're still working virtual, so it doesn't matter where you live.
Great. I'll have one more question, and then we'll kind of transition here. We hear from Jeremy that he assists Covered California, excuse me, in creating maps and outreach, and that you had mentioned the barbershops as a great resource for community outreach, and that there's an interest in creating a map of barbershops, and he's looking for an address list or any other data associated with these locations. So does anyone know of a centralized list of barbershops that's accessible?
I will tell you, there's probably no such thing. Even in trying to find all of the houses of worship, when I say churches, I typically am talking about Christian based, right? But houses of worship, all faiths. And we found over 900 houses of worship in San Bernardino County alone. But just even trying to keep that database up has been impossible. So I'll tell you the way we started. We did Google. Where
That's
are the
wonderful.
barber shops in that city, whichever city it was? We Googled them. We started a spreadsheet, put the information in there, and then we had some interns and volunteers start calling them to confirm the information.
All right, and we're getting some good suggestions in the chat too, so we'll take a look at those and share those on. Okay, I think we're going to thank you again, Deborah and Kim. It's lifts my spirits to see the way that you've taken these data and moved them into action and really have an impact in your community. So thank you so much for sharing that with us. I think at this point, I'm going to turn it over to Helen Dowling, and she can give us a whirlwind tour on HPI 3.0. Hopefully we'll answer some of the questions that have come up, but if not, we'll have time at the end and we will address those questions. So Helen, I'll turn it over to you.
Great, thank you. And honestly, I know that I'm here to share all of our exciting new features in HPI 3.0, but I don't know how I can follow those presentations from Kim and Deborah, but I'm going to try. So I'm delighted to be here today to share our new HPI 3.0. Let's start off by talking about what's under the hood of our update. First, completely updated data, including at brand new geographies like zip code and unincorporated areas. And while our data are fully updated, we took care to focus on concordance and continuity with HPI 2.0. This means that if you're familiar with HPI 2.0, you'll recognize the measures in our update. We also found a stronger correlation between HPI 3.0 scores and life expectancy with our updated data. And we've developed a myriad of other new and enhanced features for our map platform that we hope will make your work quicker and easier. I want to zoom out for a moment and talk about our race and place framing that's implemented throughout our HPI 3.0 tools. We know that factors of both race and place are proven to acutely impact health outcomes. We've updated the HPI platform on the premise that lasting systems change cannot occur unless leaders, community providers, advocates, and residents themselves understand the critical relationship between place, race, and a person's health outcomes. We were intentional about enhancing these features in the update. The ability to analyze impacts of race and place on the HPI 3.0 platform affords insight on the specific needs and conditions of each community. That additional insight allows you to develop more equitable interventions, programs, and allocations of resources and funding. It also ensures that these resources are scaled appropriately to the region. And these enhanced data and tools help communities better advocate for their own needs. So with that important context, let's dive into our new map platform. Much of the enhanced functionality I'm about to share comes directly from feedback we received from people like you who have used HPI in their work. Here are just some of the new features and enhancements available on the new platform. First, compare data across geographies and time periods. This gives you the opportunity to track improvements or declines in a community over time. Examine the link between race and place. You'll be able to assess how measures vary by race, ethnicity, and explore the race and ethnic demographics of communities you live and work in. Filter geographies by race, ethnicity, and country of origin to identify small or geographically dispersed populations. Generate HPI ranks within your city, county, and more to answer the question, for example, of how the communities in your county stack up. Access hundreds of new decision support layers, including over 30 measures disaggregated by race, ethnicity, or language. Receive policy recommendations tailored to the specific needs of your community, supporting moving neighborhood data into action. And view historically redlined neighborhoods, a policy in effect from 1935 to 1940 that has had long-lasting impacts on communities across the state. We'll talk more about these new features using a few hypothetical scenarios. To begin, Let's say a nonprofit serving Trinity and Humboldt counties is applying for a grant to expand their education work. The development manager wants to analyze third grade reading proficiency data to discuss educational outcomes in this region to include in the grant application. To support their work, this nonprofit should tap into our extensive decision support layers, over 375 in all. Let me show you how they might do that. To access these layers, click the View Indicators function in the Tools menu. Up first, you'll see individual HPI indicators organized by their policy action area. Scrolling further are our decision support layers. Among the data available, we've included measures of equity, diversity, and inclusion, climate change and climate change related indicators, as well as adaptive capacity measures, community conditions beyond the HPI, population data covering languages spoken and linguistic isolation, populations at increased risk from climate change and demographic characteristics, and schooling, students, and proficiencies, which is where this nonprofit will find data on reading proficiency. As I've demonstrated here, you can view an indicator just by clicking the button next to its name. The extensive policy guides we included in HPI 2.0 and expanded in our update, incorporating a new evidence-based rating system using the CDC framework, are one of the key components of our platform. We want people to be able to take our data into action. The policy guides represent a great resource. In this scenario, the director of the Stanislaus County Economic Development Unit is presenting policy change recommendations before the Modesto City Council to expand benefits to local small businesses impacted by the pandemic. The director can use our new built-in policy opportunities function to identify the best actions to take in their area. First, the director can access our full policy guide content through the Tools menu and the Policy Opportunities function. Here you can see a list of all of our guides, which you can then click through to explore in greater depth, including reading about the connection to health, some quick start ideas, as well as individual policy actions, like the one I'm displaying here. Alternatively, if you select a community, then click on Policy Opportunities in the Tools menu, the map automatically elevates policies that could have the greatest impact in this specific neighborhood, just what the director is looking for. This feature is an excellent way to find ideas for actions in your community and allow you to explore further right on the map. I want to take a brief digression here and share that our map is not the only place to view our policy guides. If the director wanted to explore the guides in more detail, they would find our new policy guide website at policies.healthyplacesindex.org, an accessible tool to dig deep into our policy opportunities. Showcasing our 31 guides in an easy-to-read, searchable format, our new policy guide website lets you quickly access the evidence rating for each of the hundreds of policy actions we include in our guides, along with sample ordinances, links to relevant reports, strategies and plans, templates, resources, and more. Guides are available for every indicator in the HPI, along with 8 of our decision support layers. Returning to our scenarios, we believe that California's diverse communities deserve culturally sensitive and linguistically appropriate materials. If you're designing health promotion or other outreach programs, it's key to understand the demographics of the communities you'll work within. For example, let's say that the Oakland Unified School District wants to conduct neighborhood-specific outreach to families to increase attendance and rates of enrollment. The district wants to use HPI data to create culturally responsive in-language materials, as well as identifying key messengers for each community. As a crucial component of our race and place framing in HPI 3.0, we've built in multiple levels of detail describing the racial and ethnic composition of California communities. Now you can explore data on race, ethnicity subgroups, and national origin for populations across the state. To access our enhanced race and ethnicity data, the school district can simply click on any community. After scrolling down to the racial justice and health equity section, you'll see an overview of the race ethnicity demographics in this neighborhood. Each main group can be expanded to show subpopulations and national origin data. So in this community, while about 5% are Asian, almost 3/4 identify as Vietnamese. This is exactly the kind of data the school district needs to prioritize languages, key messages and messengers, and cultural framing for their outreach. Learning about the populations present in your community is one part of examining the intersection of race and place. Another is seeing how health outcomes and community conditions can vary by race and ethnicity. In addition to offering a deeper understanding of the factors at play in our communities, it can also support an additional level of resource prioritization, like in the scenario described here. The California Community Foundation is looking to expand and revise the priorities of its economic development portfolio. Their economic development program officer wanted to look at differences in per capita income by race ethnicity to determine where they should provide resources first. Let's go ahead and see how they could do that. To access our disaggregated data, the program officer should select View Indicators in the Tools menu. Any indicator that you see with the grouped people icon next to it is available disaggregated. So they can select per capita income to load it on the map, then choose race and ethnicities from the drop-down menu here. You'll see the map reload to show this indicator by the selected group. And with that, I've appreciated the opportunity to be here today to share what is really only a brief sampling of everything new we've brought to HPI 3.0. We can't wait for you to try it out. And the best way to learn more is to dive in and explore it yourself. We'll have links at the end of the presentation. Now I'll hand it back over to Tracy to wrap things up.
Great. Thank you, Helen. So where do we go from here? We're so happy that you've joined us for this presentation. And don't forget, we are going to answer questions right after these last couple of slides. So you'll have an opportunity to ask us questions and we can answer those. We hope that the presentations, though, have helped you think about ways that you might be able to use the HPI within your work. And we are very interested in exploring new partnerships with all of you. So if you're interested in this work about the tool, we invite you to check out our website. It's at healthyplacesindex.org, and all of the information that was shared and much more is there, including video tutorials, briefs, and other goodies. So please check it out. If you're interested in becoming a very sophisticated user or really embedding HPI into your work, let us know. You can request a consultation or a custom training, and we're happy to work with you on that. You could sign up for our newsletter and receive updates on the tool as they come. We also invite you to explore the map yourself. As I mentioned, it's free and easy to use, and it's right on the site. So we'd love to develop partnerships with you. Please share this information with your networks if you think it would be important for them. We're interested in being able to reach out to all kinds of sectors because we know that other sectors have such an important impact on the health of their communities. The other thing we'd ask you to do is that we really would like to hear from you. We created an HPI community hub on our website so that you can connect with our team. We'd love to have you share your stories. How are you using HPI? What's worked well for you? We also are very interested in your questions and feedback. A lot of the things that we've changed in our updates have come from you, people that have used HPI or are interested in that. So our goal is to constantly improve the HPI, and your feedback is essential for that. We also welcome you to look and explore any trainings or consultations that we might be able to offer for you. So before we jump into the questions, and I know that you've been anxious to get some answers for some of the ones that maybe we haven't answered yet, we'd like to take one final poll, and that is, having watched the presentation now, how are you thinking the HPI might be most useful to you in your work? All right, Courtney, probably good time to shut the poll, close it. see what our answers are. Great. Well, it's a pretty good mix, actually. I think people see quite a few uses almost equally. So that's great, because we are trying to be accessible for different kinds of ways that HPI can be applied. So with that, I'd like to introduce Dr. Neil Maislish to come and join me as we facilitate some of the question and answers. And let's get to that. Neil, what do you have on cue for us?
Well, we've gotten a lot of great questions. There's a couple of themes that have emerged so far. Some of them are around community engagement and the process that we've used to bring community perspectives into the creation of the Healthy Places Index. Got a lot of questions about specific data availability issues, and a couple on use cases. So maybe I'll just start off with some of the easier questions about data availability. And I'll punt it over to Helen. I had a number of questions about can the data be acquired online? Can it be downloaded in tabular format? Would you like to tell folks a little bit about our API and download?
Yeah, absolutely. So with our updated platform, we've integrated an API endpoint. So you're welcome to go to our online map, sign up for an account, and you'll automatically get an API key. We have documentation also on our website that will show you how to develop the queries that you need to download the data. You can then also download data either in tabular format, as Neil has intimated. You can also download GeoJSON files for mapping purposes as well. So if you're interested in pulling our data down for use in your projects and your work, sign up for an API key on our map website.
One thing I'll add is I know there was a lot of discussion in the chat about barbershops, but once you get that list of barbershops and you know what census tract they're in, we do have an upload function. So you could actually map those barbershops or taxi stands or other kinds of areas where community gathers. So I just wanted to point out that we have that ability as well.
I'll make another plug too, Neil, if I can jump in. If
Sure.
Covered California or any of our partners here actually comes up with a good map, in addition to people individually uploading the data, we would have the opportunity to also include it within our decision supports as well. So we could do something to, I think, include it into the HPI if we were to get a comprehensive data set for that as well.
Maybe that's a good segue into the other themes around use cases. And there's several that were mentioned. I would point out the one around clinical operations. We had a question, how can HPI be incorporated into health plans and clinical decision making? And so a couple of ways that can happen. We have in development what we call the health outcomes equity tool. If you're familiar with how California responded to, state of California responded to the COVID pandemic, you'll know that the health equity metric uses case information. I know this is a little bit technical, but the idea is if you have a case, in this case, it could be patients in a health plan who may have diabetes, or they may have another kind of chronic condition in which you want to understand their outcomes. You can geocode, again, you meaning the health plan, because it's confidential data, could geocode the address information and assign the census tract values, just the way the test positivity rate was used in the COVID response. And you can actually ascribe the Healthy Places Index score to the patients. And then you can map the census tracts by where they fall in the distribution of HPI scores. The state of California uses quartiles. So that was how, if you recall, during the pandemic response, counties moved through the purple, red, orange, and yellow tiers. So in a clinical setting, we can do similar kinds of things by geocoding the addresses of patients and using that for population health outcomes, for utilization management, for clinical quality improvement. And you can even just map where the patients are so that you can get a better idea of how they're distributed in your service area, so you can orient services to make sure your patients get more support, more wraparound services so that they can get healthier. So there are use cases around healthcare that are very important. I should just point out that we have a number of health plans that have used the Healthy Places Index in that manner.
I see another question here, Neil. This one's probably for Helen. Are there any plans to create a health equity quartile, the bottom quartile, for within county inequities as the state did for COVID?
Yeah, that is a great question. And that is a feature that has been requested for a long time. And I'm excited to share that, yes, this is something that's actually built into our new map platform. You can generate within county ranks, you can generate within city ranks, you can generate even within school district ranks, for example. So that is available within our rank function. There's a little feature that says rank percentiles compared to, and that will be that relative rank.
We had a number of questions again around community engagement, and they focused on tribal entities and what kind of information is available for tribes. So I can answer that. There's actually several different ways. In fact, Helen, I don't know if it's possible for you to show the pick lists. There are, we use census data, the most recent census data from 2019, that gives very detailed information about tribal entities. These are ones that are officially recognized by the federal government. So this is one way in which we provide this information, and you can get down to the number of individuals who are in a particular census tract that are part of a particular tribe. I believe there are about 50 tribes that are explicitly mentioned. Another way that we incorporate information about American Indians is American Indian lands. It's another census designation where this is part of what allows users to put points on the map. And we have put the tribal areas on the map so that you can see where they're geographically located around the state. We have done a certain amount of outreach, and we will be doing more outreach with tribal entities. We've begun to talk with folks in the LA County Health Department who are experts on the data aspects of tribal entities. One of the concerns that have been raised over time is that the way the census categorizes numerically small groups leaves out a lot of folks that identify as multiple races. So if you have designated American Indian as well as others, you may not be counted. So we now have ways in which the data allows the users to look at the subgroups alone or in combination with other race groups, so that much larger pool of people who identify as that group are included. There's been a lot of criticism of groups that don't do that. So we're trying to use best practices that have actually been developed by tribal entities to guide our data provision.
Helen, did you have any more you wanted to add to that, or?
No, I think Neil did a great job talking about how we've approached this. I also want to share that the HPI itself actually has really rather good coverage of tribal areas in California. I think we cover over 90% of the population in tribal areas with HPI eligible census tracts.
Helen, I'm seeing a question coming through that's of a logistical nature, but I think an important one. People are asking, they're happy to see the 3.0 being launched, but will they still have access to 2.0?
Yes. So, couple of ways. The first way is that if you are very attached to our HPI 2.0 mapping platform, you are still able to access it for a limited time. That's at hpi2.healthyplacesindex.org, and there's a link to it in the tools menu in the new HPI 3.0 platform. But when we make our HPI 2.0 data available, it's already available within the HPI 3.0 map platform. In fact, you can use our compare data function to actually compare the changes between HPI 2.0 and HPI 3.0 side by side. So you can already view that data within the new map application, as well as you can access our HPI 2.0 mapping platform until July 1st.
I wanted to follow the theme on community engagement. There were a number of questions about have community health workers or promotores actually use the tool, or how could they use the tool? And I have to say that we often find out about use cases long after people have used them. Often they don't tell us about it. So if folks are aware of use cases, and maybe I'll just turn it over to the rest of the team or the panelists. I see Kim is nodding her head as well as how have community health workers or promoters used the Healthy Places Index?
Thanks, Neil. I'm happy to just jump in and tell you what we've done. So similar to kind of the work that Deborah described, where we provide data to the CBOs, a lot of our promotoras and community health workers are part of our community and faith-based organizations. And so we provide them with the data, and then they use the data to really kind of gear their interventions and their work at the community level based on what the data are showing. So I think it's a really natural fit. I think it's a very powerful tool for the promotors and community health workers. And so it's just a matter of getting it into their hands. And of course, they could always access it themselves, but as kind of part of that larger network of partnership between local health and the CBOs and FBOs, making that data available, and then they turn it into the action, I think is just, it's really powerful.
Great, thank you. We had a couple of questions that were a little bit on the technical side, but also that are really important is, you know, how is neighborhood defined in the Healthy Places Index? And I think we can say that we try to provide data at very granular levels, and the census tract tends to be the one that allows for enough people living there to be statistically reliable, and that's part of what census tracts are actually what we consider eligible to be included. We want to provide high quality data that is reliable, so we have a cutoff of a population of at least 1,500 living in a census tract, and that the group quarters is less than 50%, so that you don't have a big skewing of a census tract's living conditions determined by skilled nursing facilities or college campuses that may not be fully economically independent and things like that. One function that's really important, and Helen, I don't know, again, if you can demonstrate it or just mention it about the pooling, maybe you can tell people about that, because that allows a user to define their own neighborhood or their own service area.
Yeah, so we provide a number of geographies that are just built into the map. So that's everything from census tracts, cities, towns, counties, school districts, legislative districts, et cetera. But in the event that you have a project area or another geography that isn't included in our built-in list of geographies, you can use our pooling function to construct new geographies out of census tracts, for example. So you could use the pooling function, for example, if your project is one on active transportation and you're looking at putting in a bike lane and you want to see what the overall HPI score is in the corridor that you're putting that bike lane in, you can use the the pool function in the tools menu to construct a unique geography that covers just that project area. So that's a really flexible way to get HPI scores as well as individual indicators recalculated for your specific geography or project area.
Great. I see another theme that's emerging is just interest in health outcomes. And I think there's actually several ways we can address this question. One is, what kind of outcomes are related to the Healthy Places Index? And we can see that in a couple of ways. Probably the most powerful information about that is the COVID mortality data that was evolved by the California Department of Public Health, where statewide COVID mortality rates were plotted against HPI quartiles. And what was seen was a linear dose response relationship between increased mortality rates in the quartile that had the least healthy community conditions. And this was seen throughout pretty much the entire pandemic in many counties as well. So even though we calibrated the Healthy Places Index with life expectancy at birth, it does predict COVID mortality. And we are going to be looking into other health conditions that are related as well. The other questions that came up around health outcomes is, what health outcomes are available in our decision support layers. So we use CDC's Places project, which uses the behavioral risk factor surveillance system as its data source to plot many health outcomes. So we're talking about chronic disease outcomes as well as health behavior, smoking, and things like that. Those are part of our decision support layer. So we have an abundance of health information that is available. There was a specific question about CHIS data, and I believe we do have a few CHIS outcomes as well. But because we are trying to provide granular data at the census tract, the Places database actually has that more so than the CHIS data.
Neil, there's a couple of questions I was hoping to ask for Helen. I saw a question coming through, a compliment to HPI, California HPI, so thank you for that, but also wondering if other states are using HPI. So can you field that one for us?
Yes, that is a great question and represents, one of our hopes as we put HPI 3.0 out into the world, which is expanding to other states and even potentially nationwide. Right now, we're actually working with the Utah Department of Health to develop a Utah HPI. And we're really hoping that's only the beginning, that we'll be able to take our Healthy Places Index beyond California.
One other question I want to ask you too, Helen, is around the policy platform. In terms of the updates for the platform, and I was hoping that maybe you could speak a little bit to the evidence base of that again.
Sure, yes. So we are updating the policy platform as we hear recommendations from users who suggest that we look into incorporating specific policies, as well as doing periodic reviews of what makes sense for us to add there. We've developed an evidence rating for all of the policies that are included in the guide, and that's based on the CDC framework. And that's something for any new policy that we incorporate into the guide, as well as all the existing policies that are in the guides. They'll include that evidence rating, and it's visible right next to each of those policy opportunities.
Let's see, I'm seeing a question about, are there any data on vaccinations in HPI? So Helen, do you want to mention that we do have a COVID map and COVID application?
Yes. So we have a supplemental map. This is accessible at covid19.healthyplacesindex.org or from the tools menu in map.healthyplacesindex.org. And here we've been tracking COVID morbidity and mortality across the state throughout the pandemic. We don't currently track vaccinations, but we do track cases, deaths, hospitalization, as well as ICU admission rates as well. And that's updated once a week. But we have data going back to earlier in the pandemic in which we were updating it every day.
I also see another data question about incorporating the 2020 census into the HPI. Now, I know that folks may be aware that we use a census response rate, which is the 2020 census response rate, as one of our indicators. The availability of the 2020 census data is going to be somewhat delayed. It won't be available until later this year. Right now, the only data that's available is for the implementation of redistricting of congressional districts and things like that. But we'll start exploring the availability of the 2020 data once it starts to be released. It will pose a number of challenges to us and other organizations because our boundaries are based on the 2010 census, and we will ultimately be migrating to the 2020 boundary, but it will depend on the availability of data. Helen, do you have any other comments about our updating of data and 2020 census?
Yeah, I think other than to echo that it's something that is top of mind, we're thinking about it, and we'll do our best to incorporate it as those data become available.
See a couple of questions too around, do decision support layers in the policy opportunities incorporate information around park or green space equity issues?
Well, one of our main indicators is park accessibility. This might be an area that we get a lot of great feedback from our users. So if there are additional park information, because I know that there are different organizations that rate the quality of parks and things like that. One of the big challenges, because we're a statewide project, is to get data that sometimes is highly local to see if we can get it extended to other places in the state. So the person who asked the question, we should probably be in touch to see if there's other kinds of park information that could be made available other than just the geographic proximity to parks over a certain size. Let's see.
I'm seeing another one here. Is there a master file that can be downloaded? I'm only seeing downloading by each individual indicator. Thank you.
Yeah, so with our update, we've switched to an individual indicator model. So you can download only the indicators that you need at a given time. You, of course, are welcome to query the API and pull down every indicator that's within the HPI. But at the moment, we're not offering a master file as we have with the previous version of HPI.
Looking for other questions that we have missed.
I see one here. I'm not sure if it got answered. I don't think so. It says, you mentioned that you can compare data across different geographies and across different time periods. Can you explain the tracking changes over time a bit more and how that's done?
Yep, I will take that. And this is actually a great opportunity to plug the video tutorials that we've developed for the updated platform. So that's available on our healthyplacesindex.org website. And the video you're looking for is the compare data tutorial. That will walk you through both comparing a single indicator over time. So looking at 2 different time periods of the same indicator. You can look at one indicator disaggregated, for example, or you can compare 2 different indicators. So you have a lot of different ways that you can play with the various disaggregations and time periods that we make available for our individual HPI indicators and our decision support layers. So check out our compare data function in the map tool and the compare data tutorial video on our website.
I see an early question about use cases, and these are ones that are in typically rural counties in Northern California. And I'm just wondering if Bill Sadler might be able to shed some light on use cases in the more rural areas of California. Are you aware of some of those use cases?
Sure, thanks, Neil. I can speak more broadly. I know we touched on this earlier in the webinar that we've documented hundreds of use cases that have been shared with us, but certainly we know there's a lot more out there, but we know that it's being used everywhere in the state, whether as part of things like the state's health equity metric that have been applied to different parts of the state, but also a lot of transportation grants are using HPI. Some of the California climate investments are using HPI, and those obviously are grants that people apply for across the state, and there are examples of places that have used that in more rural counties as well. I will say too, I know there was a question about the business and chambers in the questions too, and while I don't have a specific example of a chamber, I know that there's just a wide variety of sectors that have used HPI and benefited from it. And that's one of the beauties of the tool is that it really has applications across a wide variety of sectors and settings. It's proven to be a useful tool.
I know we're approaching the time of wrapping things up. Maybe just one more question as a follow-on to what Bill was mentioning is that, we were very conscious about rural-urban coverage when we developed the HPI and included members of local health departments in the Central Valley and other rural areas to help inform the needs of those communities. So we were very conscious about the availability of data and the applicability of the HPI in rural areas as well as urban. I'm going to turn it over to Tracy because I think we're approaching the time for wrapping things up.
Yes, thank you, Neil. Thanks so much. And we just really want to share our deep appreciation for those of you that have made HPI possible, including Deborah and Kim for these amazing presentations and bringing the HPI to life, showing how it can be used, to our steering committee who's helped guide us over the years, to our beta testers, to our funders, existing partners, and hopefully after this presentation, new partners that we can work with. You've all helped us make this a reality, and we couldn't have done it without all of our partners. Please check out our resources. We will be sending, again, a link to the recording of this webinar. Check out our website. Please hop onto our map so that you can check it out and look at your neighborhoods or neighborhoods that you are interested in working in. If you do have follow-up questions, we've got our Ask HPI at the publichealthalliance.org. So we would welcome additional questions and conversations. And if you would like to connect with our wonderful guest speakers, you can see their contact information on this slide as well. So with that, thank you so much for being a part of our HPI 3.0 launch. We were very happy to have you here. Thank you and have a wonderful day. Take care. Thanks.